We're here at St. Clair County Community Mental Health, where Senator Debbie Stabenow will be paying a visit to highlight funding secured for certified community behavioral health clinics.
A number of years ago, I was very frustrated watching how we do physical health services in the community so well and funded as healthcare, but mental health and substance abuse services have been funded with stop and start grants forever. And so I came up with this idea of certified community behavioral health clinics, where we created high quality standards, then community centers could be fully funded for what they do.
After receiving enough support on the bipartisan proposal, Stabenow was able to fund a demonstration that became a huge success.
The numbers that we got honestly blew us away. I mean, I expected, 4 or 5 years later, you'd see some impact. But after 2 years, we were getting numbers like 60% reduction in the jail, 63% reduction in the emergency. People sit in the emergency room, 41% reduction in homelessness. And we're going, oh my gosh, this really works.
The proposal provides much needed help and support to a number of individuals and facilities.
With this new funding, this comprehensive funding that will include funding like as healthcare and providing services to children, to adults, to people in nursing homes, both addiction services, mental health services, now reaching out using other funds that I've been able to get for our schools, for our children in schools, and certainly there's always challenges for our children in school. This is about comprehensive care, funding mental health and addiction services like physical services, so healthcare above the neck, like healthcare below the neck, and people in St. Clair County really have been leading the way.
I had the opportunity to speak with St. Clair County Mental Health CEO Deb Johnson on how the CCBHCs are benefiting those in St. Clair County.
Because of that, we've been able to expand our services to the community, to people who have private insurance, people who have mild to moderate mental health conditions. Prior to that, you had to meet certain very severe criteria to receive our services. You had to have Medicaid or no insurance. But since the CCBHC, we've been able to, like I said, accept people with private insurances, and we have really tremendously increased the number of people receiving services as a result of all of that. So we were super excited to have her here today to see what we're doing in this community. So it was great.
It's been a pleasure to learn about the funding that will improve the lives of the residents of St. Clair County. That'll do it for us here in Port Huron, Michigan. I'm Harold Powell with EBWTV.